Well, good day to all of you. You know, I'm sorry, the weather forecast is what I'm going to be giving you, and the weather forecast you see outside is not sunny Southern California, is it? You know, reminiscent of my trip here in January out to Coronado Island, where it was rainy and it was 52 degrees, and it was my birthday and I was alone. I'm going to take on a bit of the travels that I've been on this year so far. So I'm going to take you first to Dunkirk, Maryland, okay, my hometown, but also to Naples, Florida, because both of those places today are mostly sunny, which is where we take a look at the scope of healthcare services at home, and you have to give that the motif of mostly sunny. I mean, I, as introduced, have been around doing this stuff for a long time, and when I look back to my origins, to what was then and what is now, I mean, it is absolutely amazing, and participated in it on a family basis as well. When I started this work, there was no hospice benefit. My father, my mother, my sister, my mother-in-law, all were hospice patients at the end of life. There was no such thing as home infusion therapy. My son became the first home infusion therapy pediatric patient in the state of Maryland, and the Blue Cross plan that the National Association for Home Care had didn't cover the service. We traded hospital days with Blue Cross in order to cover that. And you look at all of these things, but some of them that stand out: Medicaid, home and community-based services, the rebalancing of long-term service supports towards care in the home, where 3 times as many people now receive Medicaid HCBS than receive Medicaid nursing home benefit. And the spending on Medicaid home care exceeds, and has now since 2015, exceeded spending on nursing home care. Each of these advances I'm offering to you as an indication that we have this continuing growth in the scope of home care services. And when we look at there, you know, we see high-tech and high-touch services, a continuum of care which is no longer setting specific. It used to be you go to the hospital as the place to be for the highest level of care. And what do we have today? We have an incredibly growing hospital at home program in the Medicare program. It will be permanently placed in the Medicare program in the near term. It's got 2 more years of life basically as a waiver program, but all indications are that it will. There was a study released just last week indicating that hospital at home will grow by 50% over the next 5 years. An opportunity beyond all opportunities that you may or may not want to take advantage of. Skilled nursing facility at home. I have Bruce Greenstein in the audience here. He and I are kind of like architects of a bill that Senator Stabenow put into play last year and will be doing once again. And we've seen it happening outside the traditional Medicare fee-for-service program to provide a skilled nursing facility level of care at home. Some of the issues about growth are related to antiquated programs that have yet to change, haven't made it through all the gates necessary to be there. We also have one other limitation out there that we believe will be moving forward in a positive way in the near term. And you talked a lot about it in the session so far today, and that's managed care. Medicare Advantage, managed long-term service supports, commercial insurance with managed care. Is that an opportunity with a boon for home care, or is it a burden? Right now it looks to be a burden for sure along the way. But then you look at some of the other kinds of things: home dialysis, home chemotherapy, home infusion I mentioned before. All of these things lend themselves to a very sunny future for home and community-based services of all kinds. Private pay services, as well as services paid for by government programs. When you look at where that means in terms of innovation that you should be thinking about, in terms of an action plan for you, you've got to invest some of yourself in that tomorrow. I know there's a lot of burdens that are out there to deal with the today's forces in play, whether it be government regulation, the reimbursement levels, the staffing issues that are out there, but you need to absolutely invest in it in your own interior approach to it. It may be a mental budgeting or it may be a financial budgeting. Shelley Sun talked about her investment in that future with Medicare Advantage as a supplemental health benefit for home care services. She's looking at it as that investment going forward. I believe you need to be doing something comparable for yourselves. Otherwise, you know, when we're looking at the thing, you've got to staff for tomorrow too. What I mean by staffing for tomorrow: maybe this is an issue of just being stale for being around sometimes in your own organization, and the new ideas that you need to bring into it. And where do you bring in those new ideas? But maybe, as Mark King said last night, you've got them inside your organization. You've just got to listen. You know, those of us as leaders always think we know everything until we meet somebody who is clearly smarter than us and has an idea. Then we steal that idea, take credit for it, until we realize, no, the best way we go is bringing those ideas and featuring them and moving forward with them. Then one idea which we think you should be looking at, and this goes towards one of the strangest parts of healthcare services at home. Who gets healthcare services at home? It's the elderly, it's the highly disabled. What about the rest of the people? I remember the phone ringing not too long ago. It was my daughter's husband. My daughter had been taken in for an emergency appendectomy. She was in the hospital for about 3 hours and was discharged home that day. You know, talk about transformation. When I was a kid, if you went into the hospital for an appendectomy, you were there 2 weeks. You know, and you come out and you'd show everybody your scar, you know, so I'm growing up, look at my scar. She was in there for a few hours. Why is it that we don't find a marketplace with commercial insurance to pay for routine healthcare services in the home setting, whether it be hospital at home for someone like my daughter immediately after discharge? I mean, she had an incision, she had a drainage, had everything else. Why couldn't she get it at home? They weren't even thinking about it. So there's opportunities out there to continue to grow. But one of the areas when we look at more than anything else, you know, when we're looking at those opportunities today, well, is how do you get these opportunities? And I think when you're really looking at it, it falls into 2 categories. And this is where looking for tomorrow and preparing for today is continue to work on value and continue to work on assuming some risk. That is what the state of the art is for the delivery of healthcare in all capacities today, bringing value and risk taking. Now, you don't always have the right audience for that, and that we heard a lot about with the Medicare Advantage discussions earlier on. We do believe they will come around along in the next few years. So I had to write these things down because, you see, I walked in here with a presentation that was complete. And then I listened to Mark King last night, and I listened to the panel this morning, and I listened to the panel which followed them as well, and I had to make some adjustments on notes, but now we're talking sunshine all day. Palm Springs. You know, I see Brittany Salerno in the audience. We were together in Palm Springs recently. It was 97 degrees, and everybody was wearing coats because they were cold in Palm Springs. It's also in Traverse City, Michigan. And Chris is from the Michigan area, from Western Michigan. Traverse City, this is another one of my stops this year. One of the most fun, beautiful places around there. Both today are in a sunshine all day position. And that's when we look at technology and the role that technology is playing. I'll never forget the first generation of telehealth as it appeared at one of the NAHC annual meetings. And you had Philips and you had Kodak, and I keep naming all these companies that don't do telehealth or even exist anymore. The adoption rate was minimal. A lot of money cost to it. The equipment itself was totally cumbersome. It's probably sitting in, you know, your previous CEO's office, gathering dust in a closet somewhere. But today's telehealth, you know, and remote patient monitoring is state of the art and will continue to grow there. But it's not the only technologies that are out there. Clinical technologies, and when you look at it, who's getting involved in it, and what kind of message do you get? When major players like Apple and Microsoft, you know, are getting involved, Best Buy even, in technologies in the home setting, that's a bit of a clue. How many times do you see these organizations make big, big mistakes? This may be a mistake for some of them. Kodak made a lot of mistakes, that's why they don't exist anymore. But otherwise, when we look at technologies and you see, you know, that horizon that you have been watching for a while is now a reality that's there. Where are you on the technology side? And looking to things not as threats. Self-care is not a threat. Technologies involving self-care is actually opportunity. The more the consumer knows about themselves, the more they want support from you. That will continue to grow and continue to be a demand for your services. But when we're looking at technologies, we still believe we have to take the right view of this thing, that this is a set of tools for the professionals in delivering care. It's not service in and of itself, whether it be remote patient monitoring, virtual visits, But then even from an operations standpoint, home care has been ready to run with other healthcare providers now for 25 years, but the interoperability is not there yet. It will be coming in the future. We've got definite movement in financing interoperability development in home care services to involve yourself in care coordination. What do you need on that? And you've got opportunities here, and you've got opportunities in other places to be as fully aware of this as anything you can be. Don't get bogged down into today. Become aware of what are the options that are out there, what is new and what is developing. And don't just look in the US. You know, you look anywhere else in the world and you'll start to see technology starting to evolve out there. And so starting to invest in those, getting the funding for them, absolutely a step to be looking at. But you need to join us and others in an advocacy effort to bring technologies into home care with funding and support. That is not the case now. I mean, talk about antiquated. The Medicare home health benefit doesn't recognize telehealth as a service that they will pay for. You can deliver it, it just won't affect your reimbursement. Whereas in the pandemic, United Healthcare, right out of the box, said we'll pay for virtual visits. So you're looking at some burdens there that still need to be addressed in terms of the program. You know, but government benefit programs are going to be like that. Don't wait for them to take action. You need to move them forward. Oh, one last thing on the technology side. I'll go back. Okay, back. AI. Is there a more perfect fit for artificial intelligence than care in the home? To guide clinical pathways, to develop the ability to maximize the productivity of staff. And we'll talk workforce in a moment, but the biggest drawback of home care services is the non-productive time. Some of it called windshield time. And how do you maximize what's there? I mean, I flew Southwest to get here. First class ticket, all the way. The best bag of little snacks that you could possibly get. The one seat that could fit my legs in it, I'm only 6'2", you know, in the plane, and I had that seat yesterday. But what you notice about Southwest Airlines, two things. Their planes are in the air more than any other airline. And rarely do you find that they don't have a plane staffed. They have the ability to just turn on a dime to get staff in that plane if they've run into a problem with a connecting flight that the staff was on. The staff productivity time is very little downtime, and the planes have virtually no downtime. They get you on and off quickly. You like that as a flyer, but they like it when they look at their bottom line. So you've got all those action opportunities with technology even to bring those productivity improvements. All right. After we leave Palm Springs and we move to Traverse City, we go to Charlotte, North Carolina, and Point Clear, Alabama, where there is a chance of thunderstorms today. Consolidation and competition. I mean, when you want to compete, you've got to be ahead of the curve. But you see things that are happening today that make you wonder. And a few names have been dropped. I mean, like the announcement that you know, Amedisys that was being acquired by Option now has an unsolicited offer to be acquired by Optum that acquired LHC Group not too long ago. You know, I mean, that competition scares people to death, but I'm not concerned about, honestly, that competition as much as looking at some others out there who are finally seeing what you've seen for decades, and that is, you know, retail healthcare, CVS, doing home care, Amazon doing home care, physicians saying, well, why do I need to do a face-to-face encounter to order a nurse to go into the home? Why don't I just send my own nurse in the home setting? Hospitals and skilled nursing facilities, hospital at home uses what you deliver, be it on the personal care private pay side of it or on the Medicare home health side of it. They use the home health agencies and the home care providers, but will that continue? Or will they start seeing it makes more sense to do it internally? And the skilled nursing facilities that opposed our SNF benefit at home are starting to realize, well, wait a minute, the world is shifting to the home and I better shift too instead of just complaining about creating an alternative to our beds. Technology-focused entities as well. There are parties in the Philippines and in India doing remote patient monitoring. Some of you may contract with them. Payviders, the last one. This one hasn't yet made the Webster Dictionary, but it's just a year away, perhaps, and you know who I'm talking about. We're talking about payviders. But don't just look at a Humana and a United as a payvider. Look at Johns Hopkins and the Inova system and the MedStar system and on and on and on. Health systems that are creating their own Medicare Advantage or managed care plans. All of these are competitors. So what do you need to do to stay ahead of this? Eyes wide open for sure. You know, watch for the rip tides and the rip currents. They're two different things. You've got to know the difference. If you're in a rip current, you got to know it's different than a rip tide. You got to swim left or right. You don't swim in, and or you're going to be pulled out. And that's what's going to happen if you don't keep your eyes open and see what you're doing and know how to react to these kinds of things. But keeping in one mind, and this was said earlier, you know, all care is local, just as politics are local. So when you look at these very big companies, and some of you may come from them, there are a bunch of local companies put into a single organization that may bring some scale, may bring some opportunities that you might not have, but by and large look just like all of you. And for many, many years, people have sung the song of the death of the small provider of services. And I'm guessing there aren't many small providers in here, but why is it that we have more home health agencies today, more hospices today, and more private pay companies today than we ever did before? And most of them are pretty small. I mean, the large companies, members of our association, very involved in our work, very engaged, very helpful on behalf of the community at large, represent 15 to 20% of the entire marketplace. So don't run from the competition, but don't forget about them as well. The last one, the heat wave. Okay, where are we going for the heat wave? How about everywhere last week? You know, where New York City, Washington, D.C., Chicago, Illinois, Minneapolis, and all the small towns in between. Bangor, Maine, 97 degrees in Bangor, Maine. The heat wave that affects all of us is the workforce issue. It's the common denominator, but it's also the most incredible place for opportunity as well. When you're looking at that workforce, you know, you've got demand currently exceeding supply. Is there any other industry in the world that complains about demand exceeding supply? You know, yes, yours is mainly because you're either dealing with a population who can't afford price increases, or you're dealing with a population where it's a third-party payer who's setting your price to begin with. So that's why you can't take advantage of it. But when we're looking at it, you know, nurses, home care aides, therapists, pretty much every discipline is now wanted in home care. Resupply takes extended time. How long will it take to create a nurse? You know, I didn't have time yesterday to stop at the local Best Buy to see if they'd invented that 3D printer yet to create staff for home care. I did watch science fiction as a movie on the plane, and I saw all those things like robots, Transformers, you know, were on and everything else like that. Oh, I also watched John Wick 4. And if you've never seen a John Wick movie, then you probably made a good move in doing so. I lost count of it, but it was like ballet, you know, murderous ballet, you know, as it was. But, you know, we can't count on creating it just out of thin air, the workforce. You know, we got workforce availability, though, equals success. The common denominator, when you can't get referrals because you don't have staff, they're going somewhere where they do have staff. When you do have staff, you're going to get referrals whether you're big, small, or medium size, because they need what you have. So every effort that should be going into moving towards a future, to be innovative actually is a simple target in order for success. And that is recruit and retain, or maybe the better way to put it is retain and recruit staff. So when you look at that action plan, I put retention strategies really at the top. Why? What's the most expensive staff member you could have, but the one that you recruited, put into the field, and then left their job shortly thereafter? So you've made a big investment and you want to stay keeping that individual there. And the number one factor, and you know, we're going to have Brandy talking a lot about this when she follows me, you know, comes down to things like respect. Makes a big difference in keeping the workforce, but so is your flexibility, and fair compensation makes a difference as well. Recruitment today, even for jobs that pay as poorly as a home care aide job does, or paying nurses less than they could gain in the hospital, meaningful work is what people seek. want to do something that actually contributes to society, and needing to emphasize what that is. You know, the competitive compensation still being a necessary part of that, but the image of this, and we just recently contracted for phase 2 of our image campaign to get people to recognize it's a damn privilege to work in home care, and you should be admired by people all over the place. I've talked about how when I graduated law school, I worked for a public interest law firm, and my relatives at the party to celebrate my graduation from law school were all like, you could hear the buzz. He's not a real lawyer. He works for a public interest law firm. He earns $10,000 a year. You know, I had much more meaningful work than anyone I graduated law school from at that point. I think I made more contributions as a result of it. I had a poor career image because I was doing Medicare work. I had a poor career image until my relatives turned 65. Then I couldn't get away from them at all. But when we're looking at action plan, work on such things as scope of practice modernization. You know, I mean, think about this. They license barbers. Okay, licensure is not always something that is necessary to do certain things. Was there a nurse in this room who was born as a nurse? No, she was trained to be a nurse. She had competencies that could be developed in that, and we can look at scope of practice to deal with the employment shortfall. Family caregivers as employees as well. Top of the profession attitude. The attitude needs to be there. Recognizing, as Brandy's going to talk to you about, the persona fit. But when I'm looking at that weather, and I mentioned, you know, those places where it is just so hot and hot can be, you know, one of the places which I didn't mention was China. Why would I bring up China in this when talking about your innovation? China realized it didn't have the population necessary to serve the population that existed. Why? They had a limitation on the number of children people could have. And they found themselves, like we're finding in the US as well too. I had 4 children in my family, not me having the children. My parents had 4 children, 4 caregivers potentially available to them, and I have 2. And I know I've said this maybe too many times, and maybe because it's true, those 2 kids don't even like me, so I know they're not going to be a caregiver for me as well. But to repeat what was said in the panel this morning too, immigration is an essential part of what we need to have happen here. It is such a politically sensitive issue, but it's one that has to be addressed. So I want to thank the opportunity to be here today. Thank you for the opportunity to spend a little bit of time with you. And now we're going to bring on the real star of the show, Brandy.
Thank you, Bill.